Dr. David Grant. What is brainspotting?
Brainspotting is a technique that I discovered 7 years ago in working with an ice skater. I was doing very slow eye movements with her, and at a certain point I saw her eyes start to wobble and then freeze. So I just held my hand in place, not really being quite sure why I was doing it, and for the next 10 minutes all kinds of deep material, traumas and other things started to come out from her. Now I had worked through these traumas with her, most of them before, so the fact that they reopened and went to a deeper level really caught my attention. But there was a lot of traumatic memories that came up for her that I had never experienced, that never came out in the process. So that after a year of very intensive work, I saw things happening that I had never seen before. That truly caught my attention. The watchword for brainspotting is where you look affects what you feel. What that means specifically is that if you're thinking about something and it's bothering you, if you look to one direction or you look in the opposite direction by moving your eyes, you literally feel differently. Well, how can this be? Because when you look over here, it's going to a different place in your brain than when you look over here, which is going to another place in your brain. Because trauma or other emotional stress is held in different places in the brain, when you look in different directions, sometimes it's revealed and sometimes it's not revealed. So that's what it means. Where you look affects how you feel. What we do with brainspotting is we have a person bring up whatever they want to work with, and it's whatever bothers them. It's not necessarily what would be somebody else's trauma, but it's whatever bothers them or gets in the way of them doing what they want to do or being able to be who they want to be. And with that, we have them just activate themselves. In other words, just sort of be in whatever it is that's bothering them. We rate it from 0 to 10. It's called the SUD scale. 0 being absolutely no activation and 10 being the highest it can be. And then from there we ask them where they're feeling it in the body. Now we have many different ways of finding these eye positions or brain spots, but the main way that we use we call inside window because the client knows it from the inside. We'll ask the client, do you feel it more looking to your right, more in the middle, or more to your left? And it's really quite fascinating. Clients will say, oh, it's not over there, it's kind of over there, but I'm really feeling it right over there. You go right over to the spot and they say, nope, you just passed it, it's a little back. It's literally that precise. What we do from there is we have the client look at the pointer, which we hold because it's impossible to keep your arm up that long, and literally just with the awareness of whatever that's bothering them and wherever they're holding it in their body, they just look at the pointer and notice what goes on inside of themselves. And what they notice is it's like mindfulness, but it's a much more focused version of mindfulness, and that we call it processing. The brain is literally finding where the problems are inside of itself, and it's literally in a focused way processing it through. It processes it through to a point where literally it's what we call a 0 SUDS or no activation at all. I say that brainspotting is a physiological approach that has psychological consequences. In other words, we're going to places in the brain that have nothing to do with what we think or language or anything that's highly developed. We're going to the more primitive areas of the brain, the midbrain and the hindbrain, also called the mammalian brain and the reptilian brain. This is really where we hold our deepest problems. And talk therapy is not successful with them because you can't reach these areas in the brain from talk therapy. But with brainspotting, we're able to locate them through the field of vision, hold them in place, and have the client literally process them through. But it's not the client that processes them through, it's the deeper, unconscious client. And it's so deep in the brain that a lot of it just has to do with body experience and body function. There are many techniques now that work in similar ways, but what's unique about brainspotting is the absolute focused way we can find in the field of vision what's held in the brain and in the body and help to process it and release it. Now, if we're working with a simple trauma, such as a car accident, even if it's very bad, or being attacked on the street, because it's usually just in one part of the brain, we're able to find it and process it through sometimes in 1 or 2 or 3 sessions. If a person has lifelong problems, let's say that they were abused throughout their childhood. Then, of course, it takes much longer. But generally speaking, brain spotting takes less time with clients with this sort of background, and also is able to get a deeper, more permanent resolution to these issues. In addition to working with emotional problems, brain spotting is also very effective with performance and creativity enhancement. And what we literally do is find either where the creative or performance block or anxiety is and release that, or find where the creative abilities or talents are, or for an athlete where their athletic abilities are, and help to really enhance them.